We will be moving to our next track. We have with us our ANI sponsors who will be presenting to us. Dozy is our platinum sponsor. We are happy to have with us Ms. Sheja Joseph, Nursing Head, Apollo Hospital, Jayanagar. She'll be presenting on AI transformation of nursing in India. Over to Ms. Sheja Joseph.
Good afternoon all. I'm here to share my experience how AI transformation helped us in achieving zero code blues in last 300 days in our hospital. What is the healthcare scenario in India? India needs 4.3 million nurses by 2024 to meet WHO norms. According to the Global Health Security Index 2021, which measures a country's preparedness for epidemics and pandemics, India ranks 66 out of 195 countries. A day in a life of a nurse. What is the current challenge a nurse faces? Heavy patient load with the long shifts, time-consuming tasks and repetitive tasks, manual charting and early warning scoring calculation, uncooperative patients due to discomfort, untimely escalation during adverse event, and acquired infections. And we have done a time motion study to understand how the nurse spent her shift during her duties, what are the tasks they perform. So we understood that their 14% of time they are spending for monitoring vital signs and 25% of time for charting and communicating the vital signs to the clinicians, and for the indirect patient care 12%, and so on. So we can understand that total 39% of their time they are spending for monitoring vital signs and charting and communicating the vital signs to the clinician. What are the additional issues as a nursing head we all face? The nursing attrition that I don't have to explain to you all. Training issues, the upskilling of our junior staffs, poor working condition, the infrastructure problems, and lack of recognition. What is the current protocol for monitoring a patient? For the spot check, we are monitoring our patient every 4 to 6 hours. Manual calculation of early warning scores, hard to identify patient deteriorations early, delayed interventions or transfer to ICU. Here we can see in this picture that 440 patient has created an alert, and as per our schedule, staff was gone at 6 o'clock for checking, and they have realized, yes, there is a deviation in the vital signs. So they took time for identifying the deterioration and taking action, almost 1.5 hours of time. So this shows that spot checks are suboptimal. Inadequate manual checks means 67 adverse events in wards. 73% of patients who dies in the hospital, they are not admitted in the critical care area, and situation worsens more during the night shifts. A day in a nurse's life if patients are with a contactless patient monitoring. So the nurse can monitor the vital signs remotely and automatically digitalize the charts and reports, and she can spend more time for her direct patient care. How do we enhance patient safety and provide superior experience with the current technology and solution? For this, we have partnered with Dozy to solve this challenge, a made-in contactless remote patient monitoring technology. Our all beds are upgraded with contactless connected beds. So the vital parameters like NCBP, heart rate, respiratory rate, temperature, ECG, SpO2, these are the parameters monitored remotely. So, see, what is the discovery of blood pressure? In 1733, they have discovered blood pressure, and 1828, the arterial blood pressure, and 1881, non-invasive blood pressure, that is the current method of checking blood pressure. And after 140 years, Dosi has discovered NCBP, non-contact blood pressure. What are the benefits of using Dosi NCBP? Which enhances patient experience and comfort because we don't have to tie the BP cuff to the patient, continuous BP trends throughout the day, automatic documentation of BP and generation of reports, aid in customization of medication therapy. See, this is the central monitor. In the central single screen, we can view all patient data. Automation of mu scoring, customizable alerts. Depends on the clinical condition of the patient, we can customize the alerts. You can watch this video, see across
Apollo,
45
world's
hospitals
largest
in the
integrated
Apollo
healthcare provider, is setting new standards in patient safety by achieving zero code blues record through their enhanced connected care program.
So the Enhanced Connected Care program is actually a paradigm shift in the way the healthcare will be provided in the future. The reason why we thought about this program was because we know that the critically ill patients, and we know this from our COVID experience, they don't just confine themselves to the critical care units in the hospitals. You can find them at home, you can find them in the ambulances, you can find them in emergency rooms, and you can find them in the normal wards in the hospitals. Wouldn't it be nice if we could capture them before they really became critically ill? And that's the vision of this program. Pan Apollo, we are going to be monitoring our patients 24/7, round the clock.
With that objective and intent, we are looking for all technologies available in the world, and we come across with Enhanced Care, which has brought down the codes significantly, almost about in the last 200 days, I have a zero code blues, which is significant. When we take the patient on board, we'll connect the devices and we'll set the baselines and we record those things. And those vitals, whether it is heart rate, blood pressure, saturation, respiratory rate, and all those things are lively monitored in the nursing station.
If we didn't have these sensor sheets under the bed coverings, or if we didn't have the patches that go on patients' chests, if we didn't have the technology to transmit that data into the cloud and then capture it on nursing stations and in the command centers, if we didn't have this kind of connectivity, which is what technology has provided us, we wouldn't be nowhere, we wouldn't be able to start. We'd still be doing what we have been doing.
This device actually helped each nurses to save their 1 hour of time in each shift. So that has enhanced the patient care and patient satisfaction and the safety of the patient.
When patients participate in their care delivery process, they know what's happening. When we apply all these devices and patients able to see what is their heart rate, what is their blood pressure, and they also know they're continuously monitored. When they're continuously monitored, naturally they know someone is looking and monitoring me, and also with their involvement, their confidence and their satisfaction level always keep increasing.
We are covering now at least 15 to 17 hospitals out of our 70 hospitals. We only started 6 months ago, and the plan is to cover at least 40 hospitals by the end of this year. Now that technology gives us the chance of making safe care even safer, why not?
Across India, we have, in Apollo 40 hospital, we have implemented this DOSI. This is a DOSI setup we done in Apollo Jayanagar. Our 88 all inpatients beds are covered, ward beds are covered with DOSI. And this is a central monitor which is placed in the nurses station, which will be always observed by the nurse or the duty doctor on duty. The protocol with dosing. The floor nurse will get the escalation. The central monitoring system will give the alert. Yes, there is an alert. If the alerts are not acknowledged within 10 minutes of time, the Apollo Central Command Center will alert the unit supervisor. In turn, she will go and check the patient, and if required, further escalation will be done to the consultant and necessary steps will be taken to the patient. So here we can see the alerts are created at 4:40, and we get the information around 4:42, and we have taken the intervention by 4:44, so that we are not wasting any time for taking action. So impact at Apollo Hospital, Jayanagar. Total our 88 beds are monitored under dosing. Total number of patients covered are 5,000 plus. Impactful incidents are 35 plus. Our mission was to achieve zero code blue. Apollo Hospital, Jayanagar have achieved zero code blue last 300 days. These are the sum of case studies which we have come across. So for adoption of technology, continuous training is important, and DOSI is part of that for the CNEs and CMEs. And we have created a patient family education brochure, and which is given to all the patients, those who are admitted to the hospital. And operational excellence to identify the DOSI team, they are taking on-the-job training. And this DOSI is covered under insurance also. And they are part of our recognizing the champions. Monthly open forum, the patient safety champions are identified, and they are recognized by the DOSI team. And they are part of our Nurses Day celebration too. These are the testimonials by our leaders. So as a conclusion, nobody can replace care provided by the nurse. Empowering nurses with AI will enable them to deliver compassionate, precise, and life-saving care, ensuring enhanced patient safety. Thank you.
Thank you, Ms. Sheija Joseph. Next, we have with us Mr. Pinak Bandare, Head Marketing India from SCT Company. SCT is a gold sponsor. He'll be briefing on Prevent MASI with atraumatic fixation options. Over to Mr. Pinak.
Good afternoon, ladies and gentlemen, honorary dignitaries. On behalf of SCT and my team, I would like to thank the ANEI EC members, the organizing committee, Captain Ajita, President ANEI, for giving us this opportunity to be on this dais and to share what kind of solutions we bring in to improve the patient well-being, care, and comfort. The topic that I will be talking about today would be the prevention of MASI through atraumatic fixation options. Who are we basically? We are a global leading health and hygiene company based out of Stockholm, Sweden. Our India headquarters are based in Mumbai, India. A question always comes to my mind when we meet the nurses, the customers, and the other stakeholders: what does SCT stand for? SCT basically stands for the two words, which is essentials and necessity. It's a nomenclature of these two words because we feel that health and hygiene is very important and non-negotiable when it comes to patient care, well-being, and safety, and that is why we are called as SCT. For everybody and for everybody, we have solutions, we have products, we have every therapeutic area that covers today's healthcare sector. Every day our brands care for the hygiene and the health of billions of people across 150 countries today. Our health and medical solutions are offered under these brand verticals. These are our leading brands. When you look at the wound care, for the acute, we have the Leukoplast. Advanced wound care, we have the Cutimed range. Compression, we have the Jobst. And of course, for orthopedics, we have DeltaCast and Actimove. Incontinence, we don't have it in India yet, but it will be coming soon. The reason why I'm showing this slide is because wherever you go, at any part of the world, every customer you talk to would always talk about these products when it comes to the respective business verticals. Wound care are two main brands, Cutimed and Leucoplast, for the advanced wound care as well as for the acute wound care respectively. These are the solutions that provide the adhesive fixation. We have products for surgical post-op remedies, executed management, and also to prevent or manage the infections post-op. Our Leucoplast offers the solutions optimally in the three verticals, the three pillars of wound care, basically cleaning and absorption, protection and securing the wound, and more importantly, the wound dressing in the skin-sensitive patients. We have all that needs to heal the patient. We have got the solutions that treat and cure the problem statements. Just a question to the audience over here. What do these wounds have in common? Anyone from the audience? What do these wounds resemble? You could hear some prompt. Yes, these are called by the medical adhesives, which have got high impact today. MARSI, medical adhesive related skin injuries that basically cause the skin damage. It comes at a cost, it comes at a pain to the patient, reduction in the quality of life, may lead to a chronic wound, and worse if it leads to an infection, the patient care might be compromised. All this is increasing today massively and rapidly across the world. It has its own consequences on the patient and also on the healthcare infrastructure or the patient well-being. There could be a little awareness and knowledge for the HCPs, depends from the developing to developed countries to underdeveloped countries. This is more from the global data point of view. These MASIs basically caused either of the skin stripping, skin tears, dermatitis, or even folliculitis. Not a very pleasant sight even for the nurses and the sisters sitting over here and who are currently present in India across various hospitals. But whose skin is at most relevant? Some data that I would like to share. Of course, we begin with the elderly patient because the skin ages with time. Infants who are newborn, just hours into this world. Patients on certain medications, specifically the cortisone medications. Patients who need frequent dressing changes, specifically the dialysis patients. And patients with designated fragile skin. All these are commonly seen when it comes to MARSI or skin damages. When I look at the MASI prevalence, it was quite eye-opening. Developed countries like the America, it has got 13%. You look at Australia, it has got 27%. Our close neighbors, China has got 29% and Japan has got about 37.2%. It's pretty high when you look at the developed countries who have got a infrastructure, best of the patient care, and as well as the standard care of medicines that have been followed. The question mark remains today is what about in India? Are MASIs getting reported? Maybe yes, maybe no. Do we have the data? Maybe yes, maybe no. But we as an Indian country are still developing. And it's an assumption, and I believe it's a strong assumption that today MASI is still there. It's quite prevalent, and it's currently the pain point of all you sitting over here and also the leaders in the nursing, healthcare, and fraternity. Skin tear prevalence, be it any kind of a care, is it a long-term, community, acute, or palliative care? You have skin tear prevalence right from as low as 1.1% to as high as 41.2%. All this data has been documented. We always say, the nurses and the sisters always say that it should be treated properly and the healing should happen within the first 14 to maximum 21 days. But if not, it will have its own possible consequences. Infection, chronic wounds, pain, cost, everything goes for a toss. Our solution, it's there on the screen because of you. Thank you so much for each and everyone sitting over here who has admired this solution, who has blessed this product and made sure that the patient has got the best care and comfort. Why? Because it fixes, it stays reliably in place where surgical tapes often tend to fail or doesn't adhere as well. It provides a strong adhesion, it provides stretchability and it provides breathability. That's our Fixomal, both in stretch as well as in transparent. Innovation, something that we as SCTNs feel proud about. The solutions, the products that you see, the products and solutions that your team member uses are innovations in themselves. Every product that we bring is not generic, but an innovative solution. Through innovations, we have created sustainable value propositions to customers and to patients over these years. Our one such innovation that I present to all of you today, and I take this opportunity from this dais to introduce this silicon-based wound dressings. There was a myth that an atraumatic removal and an reliable adhesion may not be possible. But this combination may do wonders. And that's the combination that we bring to you, which is important to mention that we combine both the benefits together in one product. And our product is Leukopass Skin Sensitive. That is what we introduced to you today. In fixation, in post-op, we've got the Fixomal Skin Sensitive for wide area fixation. We've got Leukopass Skin Sensitive as a fixation tape, and also in the post-operative care as Leukomed T Skin Sensitive and many more. These are the products that will hit the market soon. These are the products that my team would come to you, introduce the product to you. We're more than happy to have your feedbacks on how the products are doing. If I want to advocate, yes, these products are doing very well, specifically in the oncology patients, in the neonatal patients, geriatric cases where the skin is fragile, the skin is sensitive. And they have really given an affordable solution to the patient and the healthcare industry. With that, I thank you. I thank once again the organizing committee and the EC members for giving us the opportunity to present from this dais. Thank you so much. And congratulations for this wonderful setup. And it's been quite engaging and collaborative for we as SATians. Thank you so much, everyone.
Thank you so much for supporting us. Let's give a round of applause to DOSI, our platinum sponsor, and SCT, our gold sponsor.